There was a really scary case report that was published in Prostate Cancer where some people were taking these men's health supplements and they had some ingredients that were not disclosed that were actually testosterone containing, and they actually developed rapidly spreading aggressive prostate cancer after taking these supplements. And a few of them got pulled from the market subsequently. So at least, that particular preparation isn't out there now, but who knows what has replaced it. And I think, let the buyer beware.
Yeah, so they can be harmful. They can be harmful. And there's actually been a study about how many people enter the emergency room related to supplement-related issues, and it's not insignificant. I don't know the number off the top of my head, but they can be dangerous at times, particularly because they're not regulated. Now, to move on to, you did mention breast cancer. I think a lot of people don't know that having a family history of breast cancer may put you at a higher risk for prostate cancer. So can you talk about that a little bit?
Yeah, for sure. So, prostate cancer genetics is really a huge area of research right now. And what we're learning is that some of the same genes that cause breast cancer actually also cause prostate cancer. So some of the listeners may have heard of things like BRCA or the BRCA genes. These are some of the, high-risk genes for breast and ovarian cancer. Turns out they also increase the risk of aggressive prostate cancer. So, for many years, even urologists would just ask patients, do you have a family history of prostate cancer? Yes or no, but that's not really enough. And actually, we need to know if they have any female relatives with history of breast or ovarian cancer. And there's other cancers that may be related to, like pancreatic cancer is also linked with these same genes, for example. So yeah, very detailed. It's really important for people to just, as much as possible, not all of us can get the details of our family history. And some people, may not know all of their relatives or have access to this information. But if you do, it's good to really find out the details of any cancers in family members, because that could affect your risk and also your children and your other relatives.
Yeah, it's really important. And prostate cancer is very common. It is the second most common cancer in men. Is that correct?
Yeah, exactly. And actually, they just published the 2024 cancer statistics, and the number of new cases is projected to be higher in 2024 than 2023. So it seems like the incidence of prostate cancer is actually going up, which was sad to hear. And it's also the second most common cancer in men globally. So definitely, this is very common. But, just like you were saying, men may not be aware that they're at a higher risk of prostate cancer because their mom or their sister had breast cancer. But this is also relevant for their children, whether their children are male or female. Having somebody in the family with prostate cancer could affect cancer risk.
Yeah. And so globally, it's the second most common. So there's really no variation across the globe. It's prevalent everywhere across the globe.
Well, there's definitely some variation. I mean, certain regions do have more cases than others. So, for example, North America, where we are, Northern Europe. These are some very high prevalence areas. Same with Australia, whereas actually there is a lower risk of prostate cancer in Asia. And some of this may relate to some of these dietary factors. So one day, just kind of for fun, I superimpose the prostate cancer heat maps that show the incidence with per capita meat and dairy consumption. And the overlap was actually pretty striking. And so, and what they found, they've done some of these migration studies where, for instance, they look at people who, migrated from Japan to the U.S. And the longer they were in the U.S., their risk of prostate cancer actually started approaching people who were born in the U.S. Didn't quite reach it, but went up. So something about moving to this country, which is probably adopting the standard American diet or the SAD diet, because it's very sad what it does to the body. And so just moving to the U.S. and having our lifestyle here, seems to actually raise the risk. So there's definitely some variation globally, but yes, it is certainly, common worldwide and it's great that you're raising more awareness about it on here, because it definitely doesn't get the level of funding or attention. And I think there is just some, stigma about screening and things like that.
Yeah, and we're going to talk about screening, but do you think that you said it's rising, right? The incidence of prostate cancer is rising. Do you think it's all dietary? Are there other factors, environmental or otherwise, that may be contributing?
Yeah, I mean, it's probably a whole bunch of things that are contributing. I think for one thing, there has been some controversies about screening for prostate cancer over the last 10 years. So, there was a period of time where people were saying, maybe we shouldn't screen for prostate cancer. Not everybody believed that, but anyhow, so the screening kind of went down for a while, and so some people weren't being diagnosed with prostate cancer, and now I think screening has picked back up some. So some of it may sort of be an artifact related to how much screening is going on for prostate cancer. But yeah, it's probably a whole host of different things that are at play here.
Yeah. And, a lot of people, there was this one study that showed that ejaculation frequency was associated with a decreased prostate cancer risk. And this went sort of viral in the media. So a lot of my audience wants to know is ejaculation frequency or sexual activity or prostate play or things like that, do they affect your risk of getting prostate cancer?
Yeah, so great question. And that was a very interesting study, very popular topic. I've had that on my radio show a whole bunch of times with Jennifer Ryder, who was the first author. That was actually using the same database out of Harvard as some of those plant-based diet studies that I mentioned earlier. So really large studies from Harvard where they asked these men, to discuss, the recall, basically the frequency of ejaculation. And what they found is that the people who had ejaculated on average more than 21 times per month did have a decreased risk of prostate cancer, and it was statistically significant, and it was about a 20% decreased risk. So it's a pretty, substantial finding. So there is, sort of this hypothesis about stagnation, and is there something to be said for sort of cleaning the pipes? Now, that study did not delve into, the type of activity that preceded the ejaculation. So we don't exactly know, how they were ejaculating or what type of sexual activity was involved. But it does appear that, cleaning out the tubes, may be associated with a reduced risk. Now, that being said, these are observational studies, so it could be that there is some other factor that is different about people who ejaculate more than 21 times per month compared to other people. Now, this is a very, well-established study that this came out of, so they collect data on a lot of different factors. So certainly the researchers did their best to, take into consideration as many things as they possibly could in this analysis, but needless to say. So I think, a take-home message could certainly be, that if anything, higher ejaculation frequency may have some sort of beneficial relationship with prostate cancer. However that may be accomplished, it certainly doesn't appear harmful. And, of course, with safe sex practices, since they're on the flip side, there may be some kind of relationship between inflammation or having sexually transmitted infections with increasing the risk of prostate cancer. So I wouldn't do this, while, jeopardizing, safe sexual practices.
Yeah. Yeah. So ultimately, if you ejaculate more than 21 times a month, it may help you. So by all means, go ahead, as long as you're safe.
Yes. Yeah. And, we've had a lot of funny conversations about that. I mean, I've had some very fun callers on the radio show over the years, like, Dr. Loeb, last month I was really busy at work and I only had 3 ejaculations. If I have 50 or 70 this month? Can I even it out? And, I don't think people need to be like so scared about like this exact number of 21. That just happened to be like the cutoff that they used in this study. I don't think there's any sort of, gospel to this exact number, but, just to keep it in mind. But I think it was overall a positive message. I mean, I definitely had some callers on that segment who were like, hey, I'm going to put my wife on the phone. Can you like repeat this again? Because we just have to discuss how if we don't have sex more, like I'm going to be at higher risk of cancer. So I think, in general, this is a feel-good study.
Yeah. And sex is not the only way you can masturbate. I mean, you can masturbate, you can do other things. So don't put the pressure on your partner. We talk about that a lot on my channel, so feel free to check those videos out. But in general, yes, masturbation, safe sex practices, all those things seem to be positive, at least in terms of prevention of prostate cancer, but not gospel. In terms of early signs of prostate cancer. So we know screening is there for a reason, but a lot of my audience wants to know, are there early signs or are there things that they should be sort of on the lookout for?
Yeah, and I'm so glad you brought this up because actually this is another big topic of misinformation that we've seen on Instagram and TikTok, where people are saying like early warning signs for prostate cancer. If you're peeing a lot or you see blood in your urine or your erections are not good, like these could be early warning signs of prostate cancer. No, I'm sorry. Those are not early warning signs of prostate cancer. The unfortunate truth is that prostate cancer just does not have early warning signs. It does not have any of those symptoms until it's at a very late stage. And so that is why screening is important, because you will not have symptoms from prostate cancer. So you would not know that you have it until it was already advanced. So screening is mostly these days just done by a simple blood test. And that is the best way to find it early. If you are already having some kind of urinary problem, like blood in the urine that's related to prostate cancer, then that would likely be an advanced cancer. And it is definitely better to have it diagnosed early because there are a lot of great treatment options when it is diagnosed early.
Yes. And just to be clear, urinating frequently or having blood in the urine does not always mean that you have a prostate cancer. It can mean that you have a lot of other issues that may be causing those symptoms. So don't freak out. But it is important to get screening. So what are the guidelines now for screening? They have evolved over the last 10, 15 years. So maybe you can give us a summary of what people should be doing and how often.
Yeah, so no, and that's a great point that you made, that these are usually symptoms of other things. So if you're peeing a lot, that could be that the prostate is enlarged, which isn't cancer at all. That's a totally benign process, and there's treatments for that. So it's very important that if you're having some symptoms in your urine, that you are still like seen by the doctor. And blood in the urine, I mean, that could be an infection, that could be many other things. And so all of these things should be worked out, but they are likely not due to prostate cancer. Screening for prostate cancer. So this is the way to find it early. And nowadays, what we're really recommending is a baseline test in the 40s for men. And this is really important because it helps tell the risk that you will ever have prostate cancer in your lifetime. And so, that sounds really early, but that is really the best time to do it. Now, the good news is that prostate cancer screening historically was done with two tests. It was done with the blood test and also the prostate exam. And that is not popular. That is a finger in the rectum, and there's a lot of fear and a lot of stigma, and some people just flat out refuse it. And I think, unfortunately, it's been a bit of a barrier to prostate cancer screening over the years, where people just do not want that test, so they just kind of avoid the whole thing. But the good news is that recently that has really moved more into like a supplemental role or a second line position. So really, it is mainly nowadays just focused on this blood test. So very easy, could be done with, your annual labs at a physical exam and not even a separate stick. And so I think hopefully this kind of removes sort of this impediment that's been there to prostate cancer screening over the years.